Actually, it was the delivery of the mobile unit. We finally got it today, and so it's, it's reality set in. From the time that I've been in public health and came to the health department, I recognized that there was really truly a need to meet people where they were, and in order to do that, we needed to have mobile access to be able to reach those areas where people didn't have transportation or unable to reach us. So it began, as, again, recognizing a need, and then as time progressed and we got into COVID, and it was very apparent that we needed to vaccinate our community, then it became a dream for me. And then it became a possibility because of federal funding. With that, then it became a possibility. And I went to Samuel Rogers in Kansas City and saw their van that they got. And then from there, it became a reality.
My name is Corey Green. I am the clinic manager at the Lawrence Douglas County Health Department. One thing the pandemic has done for us is taught us that prevention works. And when prevention works, nothing happens. And so our goal is to get out there and do the best that we can to prevent communicable diseases and all those things that kind of hit our community that are important to us. It's easier for us to come to you. That way people don't have to take off work. Parents don't have to travel across town. We can actually come to the school where you're at and address those needs where you are. Right now we are in the lobby of our mobile unit. This is our waiting room. Obviously we have a station where we can draw blood or do assessments or those types of things. We do have a couple refrigerators so we can carry vaccine on here and follow the KDHE guidelines on that, the CDC guidelines. Out here, this is one of our exam rooms where we can do even in more in-depth assessment, where we can pull the door, pull the curtain for privacy if we need to. We're very excited. Looks like it's a great room. We took pictures from our own employees and our own, outings that we've done to kind of make it feel a little bit more like home. And we used pictures from the people that are in our community and in our program. It feels like, you're kind of in someone's living room in a really nice RV, get ready to go on a trip. It's very comfortable, and we have everything equipped here. We don't have to bring anything on, which is going to help. Those types of things, and we're able to do blood pressures, look in their ears, those types of things. Everything in here is ADA compliant, which is really exciting. We will be able to use a hydraulic lift to get anybody in a wheelchair to get up into our unit. So there won't be anybody that we can't service inside of this unit. So we're really excited to get our staff trained. We have a couple staff members that have stepped up and are going to be driving this unit, so it's really exciting. It's going to add another kind of clinic to our facility and get people out into the community.
The plan is, first of all, for us to get comfortable with it, and then also to begin to use it for continuing to vaccinate the community. I don't believe that we will be fully utilizing the van for all of the services that we have probably until the first of the year. And again, it really is going to come down to how comfortable we are. I'm also working with community partners right now to see if we can do some dual site opportunities. Just Foods has a food truck, and we've already been in conversation with them about doing WIC services out of here in conjunction to being parked with them. When I first saw it come down the street, I had to really step back a moment because it got pretty emotional for me, because we've been waiting and waiting and waiting, and so seeing it pull up was a dream come true. I mean, it was real and tangible now, and so I ran out and asked the driver if I could get up into the van with her, and as she backed it into where it's going to be parked temporarily, and I just said to her, it's like, wow. I mean, I almost can't feel it yet because it's just amazing.